everybody. Carin Andersen here with Aortic for this week's Week in Review. If you're not familiar with the Week in Review, it's an opportunity where you get to review everything we put up last week on our social media platforms. Leave some comments and we'll get back to you. So please click like, please click subscribe. You're going to find out more why that's important in just a little bit. So I'm going to go ahead real quick and share my screen so we can get started. And I think I'm doing it right. Here we go. Okay. All right. So, first thing we did last week was our movement for movement, something we started back in 2020, just prior to COVID. And it's just that, a movement about getting everyone to feel comfortable with moving their body. And while we know that doing nothing is doing something, these articles and blogs are really meant to inspire you to want to have intentional movement. Parking the car a little farther away, that's intentional movement, etc. So this is going to be probably one of our last blogs like this format. I think we have one or two community contributors that are going to talk to you a little bit about how they got going again with moving their body and what they face and how they appreciate what we all face as community members when it comes to movement. So the key here is that movement, it's not about fixing yourself. It's about honoring yourself. And really, it's not about a goal of losing weight or getting back to where you were. For many aortic disease people, the community members, it's about thanking your body, thanking your physicians for all the hard work that they did in getting you back to where you are today. Every walk, stretch, movement, breath, everything is you choosing to care for the heart, choosing you to care for your aorta. Every heartbeat, every time you move, you're helping to heal. You're choosing life, the life that was given to you, really. And look, we know that some days means honoring your body and moving a little bit slower, maybe taking a little bit of a longer walk, maybe taking some more breaks. Strength isn't measured by intensity or distance. It is measured by consistency, compassion, and the courage to just keep moving. So this was basically in a nutshell what our movement for movement post was about. Again, reminded you, doing nothing is doing something, but being intentional in how you move your body is important. I did retail therapy the other day, probably put in over 10,000 steps between reaching for clothes and trying on clothes and moving across a very, very big mall. Yes, there are still some shopping malls. That was intentional. And I hurt the next day. So, yeah, intentional movement. That's what Movement for Movement Mondays is about. So let's move on to our next thing that happened last week was a filmed Q&A on AHTV, our Aortic Hope YouTube channel, with Dr. Mehrdad Qureshi. He is a cardiothoracic surgeon and head of the Broccoli Aortic Center at Johns Hopkins. It was awesome. We talked with him a lot about aortic valve disease, whether it was congenital like bicuspid or aortic stenosis or regurgitation. Talked a lot about how to diagnose, how to monitor, how to treat. I had my valve replaced. We talked a lot about that because he was my surgeon, of course. And we took a lot of really important questions from some of you in the community. So check that out. And you'll see that if you submitted a question, it was answered. If you want an easy way to access it, go right to the Programs tab, hover your cursor above and scroll down to Live Q&A, and you will see that the most recent video is Dr. Qureshi and that interview. So we just kind of believe that the community deserves information that is accurate, understandable, and grounded both in expertise and lived experience. So check out that video and tell us what you think. All right, Topic Tuesday, written by our med student, Jack Nichols. This month, we decided to address facts and fallacy, all of the bizarre, strange myths that we hear about in the community. And this week's myth was aneurysms never have symptoms. Where did this myth come from? Because a lot of people say it all the time. And I think it's because we've heard that aortic aneurysms are a silent killer. And it does exist for many reasons. Many aneurysms generally don't cause any symptoms until they grow to a concerning point in size or they may dissect or rupture. In fact, there's actually a large percentage of aneurysms that are actually just discovered by accident. Maybe they're found on a CT scan or they're found on an ultrasound, completely unrelated reason. So the myth actually has a kernel of truth. Many aneurysms are truly silent, but that's not the same as always. Okay. And everybody is different. So some aneurysms actually do cause symptoms. And we're going to talk a little bit about what those symptoms may look like or feel like and where they're located. So here is your fresh, beautiful aorta. If you have symptoms you could have symptoms due to an aneurysm if it's large enough in the ascending, which is still the chest or thoracic area, all the way into the descending thoracic aorta. Can also have it in the abdominal aortic area. So if it's in the chest or thoracic, you could have chest pain in the upper back or achiness, deep achiness, maybe some pressure. Hoarseness, a change in your voice, which could be due to pressure from a nearby nerve that controls the vocal cords. You could have difficulty swallowing, which would be pressure of an aneurysm on your esophagus. You could actually have shortness of breath, which would be due to pressure in the airway, or maybe that causes a persistent cough. But a lot of these things could be due to other factors like medication or something else. So you know what you feel. And when you go to your doctor and they say, this is this, if it changes at all, if you're having any subtle changes in symptoms, you need to ace your healthcare journey by advocating, communicating, and educating your healthcare team. So share with them these changes that you're feeling. Otherwise, you're going to wait a year for these repeat tests. But if you're finding changes, maybe your physician would order a test sooner, right? And maybe we would discover what is actually going on. In the abdomen area, it's a little bit different because you might actually feel the sensation of your heart beating in your belly near your belly button. Sometimes you feel a deep, slow, steady, mild abdominal pain. Sometimes a lower back pain that just doesn't go away with other traditional treatment methods. You might even feel some fullness after eating, even tiny amounts. And so while chronic symptoms from a stable aneurysm could be subtle, the symptoms of a rapidly growing, leaking, or torn, ruptured aneurysm, they're pretty sudden and they're pretty acute and need some emergency care. And that can be ripping, tearing sensation, aka dissection, in the abdomen or the chest. That's going to be like the worst pain of your life, to not so bad, but it might accompany fainting, loss of feeling in legs. Whenever it's something that's really different, it probably needs to be looked at. Okay. Lightheadedness again, rapid heartbeat, sweating, cold, call your doctor. There's nothing wrong with going to the ER to find out if everything's okay. The Believing the myth that an aneurysm has no symptoms can cause two major issues. One, patients will dismiss real changes and real signs and real symptoms. And so if they were told aneurysms are quiet, they may be scared to report a new symptom because they're probably thinking it's not even related. But your body, if it changes, deserves attention because, especially if you've had a known family history, I'm going to sneeze. Phew. Phew. Excuse me. Also, it can delay diagnosis in an actual potential emergency situation. So some people realize that their symptoms, um, they may never realize that their symptoms are related to their aorta. So they may not even know they have an aneurysm. There you go. And they start feeling symptoms. But if you know you have family medical history, or you just know something is very wrong, you need to go to the ER to make sure that it's okay. Um, because they can be silent, that's what makes them so scary and so dangerous. But the myth that having an aneurysm means never having symptoms is one of those myths worth busting. Okay, so we hope that you learned a little bit about this and you take heed and don't subscribe to aneurysms never ever have symptoms because it's just not true. Okay. Emmanuel Baca, the African perfusionist, is now part of Aorticope as one of our medical social media administrators. And I'm actually interviewed him and he's coming on tonight, everybody, at 7 p.m. So you can listen to that wonderfully fun interview. But this is his contribution to this week, and he really takes everybody inside what a perfusionist perspective is on complex cardiac and aortic surgery. I mean, when we talk about surgery, we know the thoracic surgeon, we know the vascular surgeon, we know the cardiologist, we know the anesthesiologist, but you don't know much about the perfusionist. Guarantee it. And they play a really important role because sometimes the heart has to be turned off, and you still need that oxygenated blood to flow to your whole body. So they manage the heart-lung machine, and it's not a simple stitch it on, turn it off, turn it on and off. No, no, no. There's a lot that goes into it, and so much of it happens before surgery, and so much of it happens during, and so much of it happens after. So touching upon a few of these things, and then you can always go back into our blog from last week and read this. Um, the perfusionist preparation does not begin with the heart-lung machine. It actually begins with you as the patient. Long before surgery begins, they start asking questions, your heart, your weight, because they need to calculate how fast your blood flows through your system and how much volume, so that they know what kind of volume they need and then what the timing needs to be, because your body's used to being perfused at a certain rate and certain level and certain volume, and they need to mimic that. And then they also study all your diagnostic testing. So they also want to know, are you having an ascending aortic aneurysm, abdominal, root aneurysm, arch repair? What are you having done where their services are needed? Is this your first surgery, or are you returning from a second surgery? Every patient is different. Every surgery is different. Therefore, every plan of action for surgery is individualized for you, the patient. They read all the blood tests. They want to understand how to best support our bodies. Blood count, kidney function, other important tests really help guide the perfusion plan. And your CT scan and your echo and your TEE, all equally as important, because it helps them understand your anatomy and allows the whole discussion about the operation to take place with your team before the surgery happens. So here's some questions. Do they need to cool your body to protect your brain and other organs? Do they need a special technique to keep the blood and oxygen flowing? Will there be a brief period of time where the blood flow is safely paused so the surgeon can repair a particularly complex section of the aorta? The answers to those questions really shape how the perfusionist prepares for the operation, and only then do they begin that preparation on the heart-lung machine. They actually select the equipment that best suits your body size, the type of operation you're having. They prepare the circuit, the calculation of the fluids that might be needed. They perform safety checks. They ensure emergency backup systems are ready. Did you even know that they have a buddy that sits in surgery with them, because the perfusionist chair cannot ever remain empty? So if somebody has to go to the restroom, then that they tag, this buddy comes in, and then that person can leave. That's how critical that role is. And it's a role we've never really talked about. So we are wheeled into this room. We see all these surgical gowns and people and lights and equipment, but every member of this team has literally been working together in days of preparation. One goal: to give you the safest operation possible with the best outcome. So over the next few weeks, Emmanuel is going to take us inside aortic surgery from the perfusionist perspective, and we're going to talk about things before, during, and after surgery. At Aortic Hope, we are about accurate information, having a greater understanding, more hope. Welcome to Aortic Hope, Emmanuel. We are so excited to have the African perfusionist here working with us all the way from Kenya. We're grateful that you're going to be sharing your knowledge and your personal thoughts and views, because we are providing information by the community for the community. So thank you again. I'm so excited. He will be showing us some of those inside scoops and giving us his take on things every other Thursday. So I think our next one then becomes 11, 12, 13 on the 20th. And then we hope to see a lot more from him during the month of September for AD Awareness Month. And don't forget to check out tonight on the 10th at 7 p.m. my interview. Okay. Another one of our collaborations with our partner Global Heart Hub. They are exploring new research and new research opportunities and how it opens new possibilities. I mean, that's pretty much what it is. We want to share research from them. It's been created to help patients become informed and active partners when it comes to cardiovascular research. This portal that I'm going to show you really provides all of you different types of cardiovascular research studies, clinical trials, how you can participate, why the patient voice actually matters, and opportunities to find clinical trials in your country. Patients aren't simply recipients of research. You guys are really the essential partners when it comes to shaping the future of healthcare. So whether you're newly diagnosed or you've been living with cardiovascular disease or issues for years, understanding research can help you make an informed decision and become a stronger advocate for yourself in the future. So if you come up here or you go to our research tab and you look for Global Heart Hub, this takes you directly to their page that has to do with cardiovascular health research, and it's an introduction. Click on these tabs, become familiar with this page. There is a clinical research portal. You can put in what the diagnosis is, where you live, and it'll let you know all of the clinical research studies that might be around in your area. And that, again, you can find on our research tab. Now, this, you guys, I want to talk about is our Hope Shop. There are some people, some characters that end up on Facebook pages, not the nonprofit pages, but other general Facebook pages posing as patients. And they're not even doing a really good job of it. Selling a t-shirt. We've all seen the same supposed patients with fun logos. I don't know if the link to those shirts actually are going to prove fruitful, if they're good quality, if you're going to receive them. I do know that whoever is selling them, and they are an affiliate making money off of it. Hey, no shame in the game if that's how they want to do it, but they are lying in saying that they have aortic disease because they do not. So I highly recommend that you look for posts from the nonprofit organizations or go to their pages, the ones that represent the aortic disease community, and take a look at what they have to offer. I can speak for Aortic Hope and say that no one with Aortic Hope is compensated. No one receives a salary. We do not pay people for volunteering with us or assuming any role. I'm the board chair and I do not get paid. Terry, the president, does not get paid. We do all of this as a volunteer. So every bit of money that we receive is given back towards our initiatives for all of you. When you go to our spread shop, well, this is under Hope Shop. You'll go down here to Spread Shop. It takes you to this main page. If there is a sale, you will see it listed right up here. There is no sale today. There is going to be one in a couple days. You scroll down, you'll get to see all of our designs. There's 16 additional products with just this one design right here that says, I wear my scar like a crown. And then it's asked me about my aorta. And you can continue down and see all of our current graphics. We're adding a lot more too in the next week so that you have many options in purchasing your swag in time for September Aortic Disease Awareness Month. So that is that when it comes to our swag. Now I'm going to talk to you about events. Before I go into specific events, here's our event tab. Across the top are all of our support group meetings. Anything in red is a link for you to fill out a registration form once, and then you will be notified by an email when you can join a support group meeting via Teams as of today. That might eventually change to Zoom, but it's still Teams. So caregivers only have 2 different sessions. General survivor and caregivers have 3 options. Our Canadians have 1, our Spanish is on hold, and our bereavement is every other month. So right now, going on for the rest of the month of August, tonight at 7 is our interview with Emmanuel Baca, the African perfusionist. We have Therapeutic Thursday on Thursday. John Quick is a survivor who became a therapist. We have the aortic artist on the 15th, and a variety of other things that are coming up this month. Now, speaking about the artist on Facebook, if you click our events page, you can go into the aortic artist and you will see that she is teaching us how to make decorative pavers. What you need to buy is in this event page. It tells you all of the materials. So you need a concrete paver, just a little strip, 2 or 3. And if you want to make the bumblebee house, you'll need yellow paint, black, white, brown, and orange, water, brushes, paper towel, maybe a paper plate to act as a palette, and clear sealer. Not a lot of money, talking under $10 to make a decorative paper that would go out in your yard. And that is from Diane Bishop, who's a survivor of a dissection within the community and operates Aortic Health Unlimited, which is a Facebook page. In addition, I want to talk to you about Carmen David, longtime supporter of Aortic Hope. She had a dissection, and this is her 10th run, could very well be her final run, happening in Texas on Saturday, October 29th, starting at 8:15 in the morning. You can, of course, be in Fort Worth, Texas in person, doing a 5K race or just 5K at your own pace, 10K race or 10K at your own pace. You can also walk it. You can also do it virtually from home, and you will receive a t-shirt and a medal for doing it. I've done it from Maryland on my own, taking pictures of my friends as we walk. But I wanted to give you the information about that. That's under our events page as well. And then I think that is pretty much all that I have. So I'm going to unshare here and keep talking to you, and hopefully this recorded well because I changed new platforms. But again, don't forget to click like, don't forget to click subscribe, share this because someone will get something out of this that might be truly meaningful. And until next time, thank you so much. We will see you soon.